stress, safety, smarter diagnostics. We're breaking down real health topics with real solutions. And Sage Steele joins the show. We've got a lot to get into, so let's do it. I'm Dr. Drew, and this is Health Uncensored. And my first guest needs little introduction. She's a presenter, a podcaster, co-host with me on Actual Friends because she's my actual friend. You've seen her on every topic from sports, education, and she is joining us today. Please help me welcome Sage Steele. Here we are.
Yes, this is it. But can I just tell you, your set is beautiful.
It is.
I'm in a dining room under construction over here. I'm envious, and you deserve it. You look great.
Thank you. It's so kind of you, and thank you for joining us. But I thought maybe we should just tell the brief story about how we became actual friends.
I will never forget that dinner. Drew and I got to sit next to each other, and within 5 minutes, we're sharing food off of each other's plates. I looked back and I thought, Sage, that was a little aggressive to ask for a bite. But when I couldn't decide what I wanted, I thought, well, why not? Let's just share.
It worked out great for me.
Yes, the rest is history.
One of the things I wanted to talk to you about, and you have some experience with, is non-medical management of ADD, ADHD. I'm of the opinion that my peers reach way too quickly for medication. There is a number of roads, in fact, to ADD or ADHD that are sort of overlooked. It all just goes under, treat them, give them meds. What has your experience been like?
I feel like I'm from the generation, I'm 53 now. So when I was in college, graduating, in the mid 90s, it was very taboo. At one point though, when I was at ESPN and had a big job, and I thought to myself, I'll never forget this moment. If I don't get help, I'm going to be exposed. And as the supporter of my family with 3 children, I need this job and I'll be exposed. I need help. And so I got on, I don't even remember what the medication was. And it lasted for a month because I didn't like what it did to me. And then I feel like, honestly, with some of the effects of the COVID shot that I was forced to get to keep my job at ESPN and Disney, along with menopause, it is 10 times worse. I just do not want to take pills. I don't want to do it.
Have you found any techniques that have been useful for you?
Besides prayer, Lord, help me get through the show type thing. No. But again, I've never been officially diagnosed because I feel like, again, if I go, then some doctor will put me on meds, and that's not a fix. It's a Band-Aid with other effects that, to me, they're just not worth it. I think there's a lot of shame in it. I really do. And
there shouldn't be. And I want to share a dirty little secret with you about ADHD that no one ever talks about. Trauma sends you there, substances send you there, the potential of substances send you there, genetics send you there, and menopause and aging can amplify that stuff. So there's a lot, it's not one thing. If we want to pathologize it, we can, but it's a normal variant. It's part of what we manifest as humans. Sometimes it can affect functioning. When it affects functioning, well, then we're crossing a threshold where people got to look into it. I don't experience you as having trouble functioning. I'm sorry. It's going on in your head. No one would know it. I promise.
This is the first time I've really talked publicly about it without many answers. I don't even have a good description of my journey, but I do feel like we hold it in and there's embarrassment and shame about it. So I think that was my reason for saying, you know what, I'll just put it out there and whatever comes my way from it, because they see us doing our thing and they're like, oh, look, it's all easy. And look, she's good at that. There's struggles, and I don't want to hide that anymore. And so that's why I said, I'll talk about it, even though it's a little embarrassing. So thank you. And now I need a glass of wine and it's too early.
Thank you, Sage. I'll see you next week.
Thank you.
Never a dull moment talking with Sage. Great to have her on. We've got a lot more on Health Uncensored, so stick around. With stress, burnout, chronic health issues on the rise, more people are turning to holistic wellness. I recently explored a holistic healing program designed to reset the body, mind, and spirit. I'm here in San Diego at one of the country's longest-running holistic wellness retreats. From meditation to structured raw diets, guests step away from the pace of daily life for quiet reflection in a quiet setting just beyond downtown.
My mother-in-law actually gifted me a week stay here when I was just 23 years old. That was 25 years ago, and the week I stayed here changed my life. I will never forget driving out of here on that last day. Everything was in Technicolor. The colors were brighter. The birds were louder. I just had this immense feeling of joy and clarity. And
You're almost tearing up now thinking about it.
well, my mother-in-law has passed, and I think back on what a gift that was she gave me. I have always been striving for optimum health ever since, and that connection to my higher self. Gratitude to my mother-in-law.
Because this all changed your life.
It changed my life, and I will share this gift with my daughters when they're a little bit older as well.
Founded more than 50 years ago and visited by Muhammad Ali, the Dalai Lama, and even superstar Jewel, this faith-based holistic healing program says their mission is to support healing on every level. Optimum Health Institute began in San Diego in 1976, created by its founder, Rachel Solomon, and the Nees family, who were committed to whole person wellness, later expanding to Austin in 1997 to serve even more people seeking renewal and transformation.
Was this always health focused?
Yes.
What got their interest in health per se?
All of them, like my uncle and my dad, losing their mom to
That's what did it.
cancer. And so they always had a mission to help the world heal. Our program is about putting people in a safe and sacred environment. We tend to look at holistically, and there's a Greek term for that.
Holos. Holos is the word, is a Greek word that means basically the whole piece, the whole body, not focusing on the parts.
Yes.
And so I think a lot of people forget that with holistic. Really, it's, hey, let's look at the whole person,
Yes.
not the individual part.
Everything here starts with food, not as a trend, but as a tool. This program centers on a simple, raw, plant-based diet that's designed to reduce inflammation and support the body's natural ability to reset.
Big belief of a lot of the people that come here to OHI is that the body can heal itself. And believing that it can do so, and with the support of rest, support of community, nutrition. This type of diet is important is because it goes back to the core foods that our bodies are designed to eat. These wholesome, ready-to-eat foods right off of plants, right off of trees, right out of the grounds, rather than foods that have gone through a lot of hands.
So real foods.
Real foods, nutrient dense, nourishing, easy to digest, and delicious.
What we eat matters, but the fact that we take into account here all aspects of being alive, you know, your thought life is contributing to your overall health, your emotional life, your spiritual life. There's a class that we have called Mental Detox. We have classes on mind-body connection. And so just understanding the relationship between our thoughts and beliefs and our stress response.
Each day here follows a natural rhythm that provides guests with the tools for a lasting transformation. But don't be fooled. This program is strict and requires some discipline.
There are people who I tell them about it and they say, oh, I don't think I can do that. I'm like, you sure can do anything for a week or 2 weeks or 3 weeks. I mean, it's really the transformation. People have epiphanies and they have, you know, just like experiences, a community. I mean, that's one of the main reasons why I keep coming back. It's like, you can't really do this alone. You know, having people going through the same exact thing as you makes it so much more doable, so much more fun.
No miracle claims here, just a structured approach designed to support transformational lifestyle changes by helping people pause and take a more intentional role in their own well-being. If you're interested in learning more, visit OptimumHealth.org. As mental health challenges rise and access to care remains limited, a new non-invasive therapy is offering some hope. Let's head to Fort Collins to follow one patient's journey.
I don't have to feel like I have to rely on something. It's natural. It's just the regular dose of just being happy that I have not felt in over a decade and a half.
For 16 years, Miranda struggled with depression and anxiety, taking medication after medication with no relief.
The last set of medication that I was on completely just made me sick to my stomach, dry heaving, just sick constantly all day long for several months, and I couldn't do it anymore.
Turning to her doctors at the Miramont Center, they recommended she try a more holistic approach after a proper evaluation.
ExoMind is a breakthrough in the treatment for mental health. It basically stimulates neuroplasticity, allowing new pathways to develop inside the brain. And it's doing it in the centers that control and regulate our mood.
Before, I was not wanting to be around people, very homebody hermit-like, and down on myself, lacked self-confidence hugely. And then after, my mind is just clear. I can think, I can focus, I'm happy, I don't have to force myself. Not only that, it has made my relationship with my kids and my husband even stronger. It's changed my life in a very, very great way.
Well, I'm intrigued to learn more. Joining us here now to talk more about ExoMind is Dr. Bender and psychiatric nurse practitioner Samantha Davis. Welcome, guys.
Welcome.
I appreciate it. And you're the CEO of the Wellness Center as well.
That's correct.
And how did you get involved with this?
Well, Sam completed her psychiatric board certification and was telling me about all the great things she was doing with transcranial magnetic stimulation, using magnets to cure depression. And we wanted to get into the 3rd generation machines, which is ExoMind by BTL.
And this works by creating a magnetic field that then causes a current in our head, essentially?
Well, it sends out magnetic pulses to that left prefrontal cortex.
Well, I would like to offer the treatment to somebody in our audience. How's that sound?
We would love that.
So what is happening right now while we're doing this?
Well, she's being positioned,
Yes.
and first we have to achieve what is called capture. So everyone has like a different threshold for receiving their treatment. And so Brandy is going to configure the machine based on her demographics. And then once she has achieved capture, then we can start the session.
What is it designed to treat?
So it's for major depressive disorder, OCD, and binge eating disorder.
Binge eating.
We're using it off-label to treat people who oversex, overdrug, overdrink alcohol.
Like people who have ADHD, you know,
Oh,
it helps
oh my
improve
God,
and
it would be
people
great for that.
get off of medication. I mean, it's just amazing.
She done? Yep. Okay, Lauren, sit up and tell us what happened here, what you're feeling. So how was it?
It was great. I feel really relaxed. It didn't hurt at all, and I'm ready to feel the changes.
Well, we appreciate you allowing us to experiment on you.
you.
And it's all for the good.
Yes.
Brandy, thank you. Oh, you guys, this is very exciting. I know this will continue to expand. I kind of see when there's been a breakthrough, and this is one of those things. So thank you for doing it. Be sure to ask your provider about this treatment and learn more for yourself at Body by BTL. One word, bodybybtl.com, and then search ExoMind, EXOMIND. Go away, be right back. We're going to look at the world of dentistry. Now, obviously, we go to hospitals to get better, not to get worse. But between hazardous materials, medical waste, keeping a clinical environment safe is a monumental challenge. We went to North Carolina to hear how one leading voice is tackling this head on. Here's our story.
Yeah, pharmacists that work in the oncology setting will be exposed to hazardous drugs every day. And again, chemotherapy, by and large, are known to be hazardous medications. And so if employees are getting exposed to small amounts over many, many years, these individuals are at increased risk for getting cancer themselves just by having exposure to these medications. That is a big concern, and that's the reason why I got so passionate about this, is because we could introduce a tool that would help protect hundreds of individuals across the United States as they prepare and administer chemotherapy. I continue to believe that education is the most important step to be able to bring awareness to this issue. If people understand the risks and the concerns through education, then they're going to want to actually do something about it.
With me now is one of the people helping to revolutionize the way we look at the risks related to health and hygiene. This is associated with surface exposures of hazardous drugs. Dr. Bill Zamboni from ChemoGlow. Bill, thank you for being here. How did this all get started?
Well, on my second day of work at UNC, Stephen Eckel, who's one of the co-founders of the company, knocked on my door. And he said he had this concern that when they were making chemotherapy in the hospital or pharmacies or infusing in the nursing units, that it was leaking and getting out and getting on surfaces. And so it would be an occupational hazard.
So you went out, looked at the problem, there it was. How did you figure you were going to solve it?
Well, I was very shocked that when we did our very first studies in a couple pharmacy hospitals, the levels that we're seeing was a whole series of anti-cancer drugs, which are cytotoxic. Very high levels in just about every exposure area that we looked at.
By cytotoxic, he means poisonous. It's bad.
Once we saw that, we thought, wow, we have to figure out a way to detect as many drugs as we can on as many surfaces. And then once we could do that, then we could develop technologies to clean it up.
So how do you clean it up?
The problem is the chemistry of different drugs is so different. If you use water or alcohol or some mixture, you can't clean up them all. So when we had the ability to go and do different ingredients to figure out how we could clean up all the different drugs and then develop a towelette that would soak them up and pull them off the surfaces.
It's a lot. And so what do you do?
So we're setting up a systematic way that we can monitor or detect them. And then once we do that, we can bring in our cleaning products to help them remove the contamination.
And I'm just, the way you describe it, it seems to me that this is something that's got to become standard in every hospital and every pharmacy.
There's actually, it's called USP 800, which is kind of a regulatory body of the pharmacy, and they put it in that you need to test and clean up every 3 to 6 months.
Okay,
Yeah, so
and are you guys the go-to for that?
We are the largest testing facility in the country.
And I'm guessing this is becoming a growing field. What sets you guys out from your competitors?
We solely focus on this. It's interesting. I think what's best about ChemoGlow, it's not just one product, that we have all the products are needed. We have the detection kit, we have the cleaning products, and then we have the management solutions from our database that we know when they need to measure it and where and what to do.
This is a big thing.
Yeah. This is something that we started 18 years ago, and it's really making an impact.
Well, thank you for doing it. Thank you for sharing it with us. As you said, to learn more about ChemoGlow or to get access to their incredible products, check out chemoglow.com. Again, that's CHEMOGLO, chemoglow.com, and stick around. I'll be right back. Most of us don't think much about our dental x-rays, but what if they could catch serious disease before you ever felt a thing? AI-powered imaging is turning routine dental visits into something much more powerful, and it could just save a life.
In the past, we had film, so the dentist is holding it up to light and everyone's he's telling you, look at your tooth, look at this infection, and the patient's kind of playing along saying, yeah, but do they really understand what you're telling them? And we've evolved into digital technology, which is black and whites on a screen. And now what we're seeing is colorization, what we call segmentation, where each bit of anatomy, down to not only the tooth, but down to the pulp, the dent, and the enamel is identified. That is the standard of care now. You're seeing more now as a clinician. It's immediate. There's no clicking, there's no mousing around. Their first initial reaction is, wow. They're blown away. They say, wow, I can't believe that's me. And when that happens, they absorb and understand the content that's being told to them, and they're gonna accept care more often. And that is our overall mission. We wanna help in that fight to have access to care and have our communities healthier. I've never been more hopeful that more people, our communities are gonna be treated appropriately with the right care through this advancement in technology. Vatek is a pioneer in this dental AI race. I'm very, very proud to represent Vatek America.
Joining me now is Louis DiFilippo, the VP of Sales at Vatek America. Thank you for joining us.
Oh, thanks for having me.
This is particularly interesting to me as a clinician. I've actually had dentists call me and say, I'm seeing something. I don't know necessarily what it is, but you should take a look at this patient and follow up. And one patient called me and said, looking at his gums, I think it's diabetes. And he was right. And so you can tell a lot from the mouth, and I don't think the average person is aware of that.
Yeah, absolutely. I think where we've been and where we are today It's incredible. And now with the advent of AI, we're able to detect things that are asymptomatic, if you will, in some cases.
Is it just the 3D X-ray imaging or also the plain plate images?
Great question. Both 2D and 3D, AI is revolutionizing both in terms of diagnostics in the dental office.
And is it helping the AI, helping patients understand the dentistry also? Because I look at those X-rays, I can read X-rays, I get confused.
I think that's the final part of where the AI is influencing the dental practice, is the communication to the patient. I think on the front side, it's comprehensive evaluation and then diagnosis in an expedited manner.
Medical.
Dental.
Medical and dental.
Absolutely.
Okay. And what kinds of medical issues can be detected this way?
Well, a primary one is a huge concern for the US population, which is airway. So initially, you could take a full head scan, CBCT, low dose in terms of radiation, and evaluate the full head. Primarily, dentists are concerned with the teeth, but now, sleep apnea is a huge concern.
Oh, I see. So you're evaluating sleep apnea also.
That's absolutely an added benefit. What I want people to know mostly is that there is a incredible revolution taking place in terms of the technology. And everybody talks about AI. Well, what is it? This is the good AI. A lot of times they don't trust what's being told to them, or they don't understand. And now with your face being peeled away down to the infection, it makes it easier to understand, and hopefully patients are accepting care more often.
Well, thank you for sharing this with us, and
thank
you
you
for pursuing it. It's important stuff. I mean, AI is the future, there's no doubt about it.
It is, and it's moving very, very quickly, so it's going to help a lot of people.
To learn more about how AI is revolutionizing dental care and how to find out more about Vatech's innovative technology, visit Vatech, it's VATECH, VatechAmerica.com. Stay put. We'll be right back. Health insurance. 2 words that can make even the smartest people feel lost. It affects your health, your finances, your family, yet most of us don't really understand what we're signing up for. Me too. So, we're breaking down why it is so confusing and what actually helps people make better choices.
There's so many misconceptions about the individual healthcare insurance market, and what we set out to do is to change some of those things.
Traditionally, people think about insurance as group-sponsored employer insurance, especially my generation, right? Times have changed in the last decade or so, and there are a lot of options, and people have choice. Most agencies sell what they know, and they don't present all the options to the consumer. We make it easy for them to do that.
Independent agencies really do want to help customers, but the reality is that they're working in systems that are outdated or siloed, or just don't have the right information in a high-pressure environment that lets them serve well. And so what our system allows them to do is make a lot of those challenges sort of disappear. One of the things in this space that's very important to understand is that we don't actually sell to the consumer. We are arm's length removed. So by the way that we show up in this sort of agnostic state and providing robust options, and the optionality really helps us serve the insurance agents, which in turn make a great relationship for the consumer and serve them well too.
So if the system is broken and agents are caught in the middle, what does a better insurance experience actually look like? Well, we're going to talk to the team that's working to fix it. Welcome, Todd.
Nice to be here.
You as well. What is Hethos?
Hethos is really a company that offers a platform for independent agents and agencies to sell health insurance.
So for the average patient, they only experience frustration, right? That's all we know is like, oh, I don't understand what they're telling me. I don't understand how to pick a good policy.
Well, more and more consumers are shopping for health insurance like they are any other type of insurance. The problem is that in the licensed agent world and in the small brokerage world, they can sell only what they're contracted to sell, or only one type of insurance.
Or what they know, because it's changing so fast, they can't keep up.
It's changing so fast, exactly. Yeah. So our platform is, enables them to do that with relative ease. There's regulations by state, there are different types of products. They're allowed in states, and so we keep up with all that and provide a platform where the independent agent can talk with ease to the consumer about what makes the most sense for them.
So that's interesting.
Yeah.
I don't think the average consumer would understand what you just said. But that's, I think, the future. Right?
Absolutely, the future is enabling the consumer to make wise choices.
And being price conscious and actually looking at prices and using technology to access healthcare.
The system is set up in silos where the agent, again, exists to sell this one product. So they're trying to solve a moment in time issue for the consumer using the products that they have available. Instead of thinking comprehensively about long-term, let's expect this person to be able to, this insurance to be portable. They take this with them. As they age through life, they're going to be, my customer as an agency. So how do I think about bridging the gap, early retirement, bridge the gap to Medicare, and then helping someone when they get into Medicare?
So really being a source of information and guidance.
Throughout their life's journey.
Yeah, throughout the lifespan. How can you guys help out with individual consumer health reimbursement accounts? These are these individual savings accounts for healthcare.
ICHRA, yes. Many employers, especially small employers, are considering that as an option, which is a really creative option. I think part of the challenge with adoption there is that they're trying to adopt what is the traditional group model to support.
They're pooling risk.
50 people. Yeah, exactly.
Yeah.
Well, that's where we can help because the adopting a group model to support that really doesn't make sense. But we're already in the individual space. We already collect premium directly from each individual consumer. So adopting our model to support an ICHRA platform.
So this again is the future where an individual can get help in their own savings plan.
Absolutely, and they take that insurance wherever they go.
We need this, so thank you.
Yes, thank you.
And if you want to learn more about how the health insurance experience is evolving or what to look for when choosing coverage, do what I've just said. Go to Heathos, Heathos, Heathos.com. Stay put. Be right back. Taking control of your health is the first step, but seeing the future could be the next. Stick around, because we're looking at how AI is revolutionizing the way we look at our health, past, present, and future. And Sage Steele joins me for a one-on-one discussion you will not want to miss. It's all next. I'm Dr. Drew. We'll see you then.